Welcome to the Fit Drivers Podcast, sponsored by PrePass. Only PrePass provides way station, bypass, and integrated electronic toll payment services, saving you time, fuel, and money while improving safety and efficiency in trucking. Visit prepass.com for details. Well, good morning, everyone, and thank you again for tuning in to another Fit Drivers Podcast where you get the latest information on driver health. And we're always trying to come up with solutions for our drivers out there to keep them in the seat, healthy, and on the road. And today I've got a really special guest that I'm pleased to introduce that we haven't had a chance to meet yet. And I just was fortunate enough to meet Gilles through another contact. And so on today with us to talk about sleep is Gilles Frydman, currently the Executive Director for the American Sleep Apnea Association, ASAA, is the leading figure in patient-centered healthcare and medical innovation. Gilles has spent the last 3 decades creating, empowering patient communities. In the mid-1980s, he founded the Association of Cancer Online Resources, ASAA, which has become one of the first comprehensive online support networks for cancer patients and their families. Gilles, my friend, welcome to the podcast, and thank you so much. Really pleased to have you on today.
Hello, my name is Gilles Frydman. I'm the Executive Director of the American Sleep Apnea Association, and I'm delighted to be here for the Fit Drivers podcast.
Great. So we're going to jump right into this. I've got some questions I want to talk to you about. But first, take a few minutes, Gilles, and just kind of explain to the audience about your association and the work that you're doing, and then we'll get into some detailed questions. Go ahead.
Sure. The American Sleep Apnea Association is the oldest and the largest patient advocacy organization for sleep apnea. And it's more than 30 years old, and we're currently expanding our vision to include something bigger than sleep apnea, which is sleep health, because without sleep health, you don't have health. Sleep comes first.
You bet. Do you have any idea, which I'm assuming you do, how many, just not drivers, but people, Americans in the U.S. suffer with sleep disorders?
Sure. So before I respond to this, as you know, sleep is one of the 3 main pillars of health, along with nutrition and movement. It is a fundamental part of our overall health and well-being. Unfortunately, more than a third of Americans report getting less than 7 hours of sleep in a 24 hours period. About 30% of adults have symptoms of insomnia, with 10% having insomnia that impacts their daily activity. Between 30 and over 50 million Americans experience sleep apnea. Of these, more than 20 million suffer from moderate to severe sleep apnea, which definitely impacts their daily activities and their overall health. And yet, despite the high prevalence of sleep disorders, most go undiagnosed and untreated. For example, although sleep apnea affects 20% of US adults, 90% of them are undiagnosed.
Wow, 90%. That's a big
Between
number.
85 and 90, yes, very big number.
So tell me, how did you get, I know you have a pretty extensive background in, helping people, self-care, that type of thing. So tell the audience how you got involved with the association and where it was at and where you've taken it to now.
Sure. So like many people suffering, like most people suffering from sleep apnea, I did suffer from it for many years, probably decades before I got diagnosed. And it did impact my health in many ways. I forgot to tell you that why was I mentioning the statistics at the beginning? It's just because getting enough sleep is important for our overall health. Lack of sleep or disordered sleep, like sleep apnea, have been associated with poor quality of life and increased risks for type 2 diabetes, obesity, heart disease, stroke, cancer, and even death. So people who don't get enough sleep are also at a higher risk of stroke or dementia. And since I was involved for decades with helping people with disease that untreated almost invariably would lead to death. It was, I was really shocked when I started paying attention to sleep to learn that it has an impact on everything that we do. It is not as scary as cancer, but its effect is really profound. And broken sleep is going to shorten your life. The day when I understood this, I said, that's it. This is my new passion. I'm going to help people figure out how to get better sleep and better sleep health so that they can live a full life to the maximum of their ability.
Interesting. Well, I know when you and I first met, you really grabbed my attention, and why I was really compelled to have you come on because you mentioned those three pillars. And of course, in the network of folks I work with professional drivers, I use those same terminology. It's about movement and nutrition, and of course proper sleep. And in the world of the professional driver, unfortunately, they have to go with a lot of without, and a lot of times that means sleep. And so that without sleep, as you mentioned, it really does have a direct reflection on their health and their ability to stay focused and be safe. So I'm always interested in trying to find more and more ways to help these men and women out there, stay alert. And because what I found in my experience is if I can help them with their sleep, and as I use the term, get sober, they have more openness, Giles, to want to take on the opportunity to exercise when they can and make better food choices, because they're well rested, right? They got more energy, and they're ready to make some big decisions, some big changes in their life to help get to the next level. So I know you and I have talked about the driver population. I know you're not directly involved with doing DOT exams, that type of thing. But, when I look at the statistics, and I talk about these all the time on my podcast, that probably almost 55 to 58% of our CDL drivers out there today operate on a short-term card. And I say short-term, I mean 1 year or less. And when you get a 1 year card, that means you've been diagnosed of one of three things, whether you're hypertensive, pre-diabetic, or you have sleep deprivation. And it's a big issue out there. So I always am looking, like I said, better solutions, better ways of our drivers to help. So for people who listen to our podcast, and a lot of times I got drivers listening as well as HR people, executives, and so forth. Tell me about how you help the population get results or get, I guess, treatment. And one of the things that you and I talked about, you had a pretty unique economic solution for men and women and that's always one of the problems in the driver space, is that they don't have insurance and the company's not covering it, then it creates a pretty big financial burden for them to get treatment.
Sure. I'm absolutely delighted to tell you about the program that the association has. But before I do this, I have to repeat what you just said, which is that the three top issues that you see that are most common are elevated high blood pressure, right, high glucose level, and sleep deprivation. When you present it like this, it feels like those three are unconnected. But in reality, there is a significant percentage of the people that have elevated glucose level, high blood pressure, and sleep deprivation. A significant portion of them suffer from sleep apnea. Disordered sleep generates sleep deprivation, which in turn produces all kinds of cardiovascular issues, including high blood pressure. Sleep apnea affects 30 to 40% of the people with high blood pressure. And of the people diagnosed with sleep apnea, it is estimated that around half of them also have high blood pressure. So it's very difficult to disconnect those three. They are part of a mix that probably in a very significant percentage of people starts with broken sleep, disordered sleep. Now, back to your question. Since sleep seems to be the starting point of those chronic problems, The association, the American Sleep Apnea Association, decided a while back to help individuals who are either uninsured, underinsured, or simply can't afford a machine at the commercial price. We have a program called the CPAP Assistant Program, and since 2010, it has been a vital support system for over 15,000 sleep apnea patients facing
Wow.
financial hardship. We understand how challenging it can be to manage health when resources are limited, and we are committed to ensuring people facing financial hardship can get the PAP therapy they need to improve their condition and quality of life. Our machines are donated to ASAA through our CPAP machine and supply donation program and are gently used or new. All the machines are clean, tested, and are in good working order. They will be set based on the individual prescription. Yes, you must first obtain a prescription before we can help you.
Correct.
All the masks, tubing, and filters are new and factory sealed. So the CPAP machine package includes one machine with a humidifier and chamber, one tubing and filter, one mask, and one carrying case. All the machines have SD card memory card capability. That is an important feature, ensuring you can easily track your sleep if you decide to do it on your own and share your therapy data with your doctor. There is a program fee for this program of $200. To join the program, you will have to complete our online application and submit a copy of your CPAP prescription with the pressure settings listed. Submitting your prescription and application as soon as possible will ensure that you receive a CPAP device at the earliest opportunity. Sometimes we have a waiting list. I think that currently we are with a very short waiting list. You won't be charged any money until we have a machine available for your specific needs. And I hope that this program can help many truck drivers who can't afford to go through the regular commercial system.
Well, you certainly add very compelling economic offering for men and women out there. So how do you, and I'm sorry, repeat the number again, how many people you've actually helped and put into your program?
15,000.
Wow. Okay. And how do you now, are you able to get the information out there and how do you educate the public in general about the value in sleep and how it's part of the three pillars? What is your social media? Do you have a marketing?
Yeah, we do have social media presence. We are building a new website, which will go live in a couple of months.
Okay.
We do have a significant presence on Facebook, and we have a presence on Instagram. We're no longer really active on Twitter, but we may start again.
Right.
And we are definitely active on LinkedIn.
So, tell me, I got to ask this because of someone that does a lot of driver health and wellness posting on social media. I always see these different, ads running about people getting these, special devices that you can put in your mouth and or cover your mouth and so forth, or tape over your mouth, or certain guards that you can put in your mouth to help you sleep. Do you have any information? Do any of those really work, or is it just really just a marketing program out there? Do any of those have success in helping people with their sleep disorders?
So you can use devices that are that you can get through a dentist, some dental appliances that seems to be working very well for some people. For most of the devices that are advertised on TikTok and Instagram, I would say, after having spent 30 years in the world of cancer, I am acutely aware of what snake oil is and how easy it is to convince people to spend money on improving their health without having any kind of scientific background. So I would say that in general, if some comments are made about a device and it sounds too good to be true, it probably is.
Right. Right.
The mouth taping probably can't do much damage. Can it do some good? Maybe in some people. But I would say, since sleep apnea is a really serious sleep disorder, if you think that you have sleep apnea, you better get it treated with proven solutions.
Right. So tell me, so if for drivers who hear this and I post it or reach out to HR departments and also work with some, clinics around the country, how do they find you? How do they get the information? Where do they go to be able to fill out the application?
Sure. Sure. Our website is sleephealth.org, and in the menu under patients, there is a link to our CPAP assistance program.
And so there is where they fill out an application to apply to see if they
Yes.
qualify. Is that right? Okay.
Well, most of the people who applied qualify. They just need to make sure that they do have a prescription, because we cannot give machines without a
Sure.
prescription.
So another important piece I believe you touched on, but I want to make sure for those out there, because part of this, when you're within the DOT regulation, I mean, they have to stay compliant, right? And they have to have a means of being able to track it. And these machines that you have that capabilities, right, that they can report that information back to
Yes.
whatever DOT. Okay.
Yes.
Right. Perfect. They make sure they're compliant. They can do that.
So not all the machines do have cell capability. So people may have to send a copy of the data to their doctor or bring it to their doctors, but the data is definitely recorded in all the machines.
Okay. Very good. Very good. So I want to talk to you also too about in your association, especially wanted to mention that when you said you're relaunching your site, so I'd like to make sure once you do that, send that back out to me, that new information, so we can let people know that as we follow up and other people come to review the podcast, that they'll have the correct information in there, the new website and so forth.
Of
And
course.
so,
And I think that we're going to have a section on the new website done with, like, in association with people in the trucking industry, such as yourself, to have pages that are more specific to the trucking industry.
Great. So another question I had, because you obviously you really emphasized the point that this is part of the 3 pillars. Is that something that you talk about when people apply and they get their machine? Is there information that you tell them that they really need to really look at also taking care of the other 2 pillars, which is movement and nutrition, when they get the machine? Is that what you talk about?
Sure. Absolutely. I mean,
Yeah.
The reality is that all of us need to understand the significance of sleep, and that it's not just like falling asleep. Sleep health is a bit more complicated than this, and it's definitely associated with nutrition and movement. Those 3 pillars of health, if you make efforts in behavioral changes, can can improve your health really significantly and expand your life.
Well, I can tell you from experience from over the years working with drivers and those who have to get involved in a sleep program, I mean, thousands that I've been associated with. I can say this, Giles, that I've never had one yet that came back and said it didn't change their life for the better. I mean, it's been a game changer, right? I mean, right?
You can be sure
don't go anywhere without it. Yeah.
In order to feel the benefits of treating your sleep apnea, you don't need to be a truck driver. Believe me, I was, as I told you, I probably had sleep apnea undiagnosed for decades. I think that I'm one of those people that probably suffered from it since I was a child. But when I got 20 some years ago, by early afternoon, I started to just fall asleep. I couldn't have an entire day without falling asleep. And when I said falling asleep in the afternoon, it's like suddenly falling asleep, not being able to be up. I
Right.
could, I just can't imagine if I was a truck driver, the kind of danger that I would carry with me. And the fact is that now
Oh,
that
yeah.
I treat my apnea religiously, I almost never fall asleep during the day. And it's not
Wow.
just falling asleep. It's the ability to think, the ability to react. Uh, I'm a
Sure.
very long distance driver, and I can tell you, I feel the immense difference of my ability to drive now compared to what it was like 15 years ago.
Right. Well, Giles, I can't thank you enough for coming on. I mean, I think this is going to be very compelling to a lot of drivers, HR departments, benefits sections, and so forth. So read that website one more time, please.
Sleephealth.org. It's really quite simple. In one word, sleephealth.org. And I hope we can help many of the drivers that are listening to you. I just want to
Absolutely.
say one more thing about my personal
Please.
story. Again, I've been suffering from refractory high blood pressure for 30 some years. And when I say refractory, we've tried 9 types of medication and combinations before we found one that probably worked. I mean, hopefully this one has been working for a very long time. Hopefully it will keep on working. The amazing thing is that the cardiologist, internist, and GPs that I saw, not a single one of them ever asked me a question about sleep. And it's pretty obvious that the refractory high blood pressure that I have came from sleep apnea. So, one comment for the drivers that are listening to you, drivers or other people that are listening to your podcast: if you have high blood pressure and you don't know where it's coming from, ask your doctors if you can have a sleep test.
Very good. That's good information. And thank you so much for telling your story. I really appreciate it. And thanks again for coming on Fit Drivers Podcast. And also, I want to thank my sponsor, PrePass. I couldn't do this without PrePass, and I appreciate their support very much in getting this critical information out there. So we'll get this edited and probably get it posted up, Monday, Tuesday at the latest, and I'll let you know when it's up. And in any outlets that you have that you could, forward it on to for people to see and hear more about it,
For sure.
I'd really appreciate it.
Yeah.
Absolutely. So, Giles, thank you, my new friend.
Did I respond to most of the questions in an appropriate way?
You did very well. Very well. Thank you. I really appreciate it. So I'll be reaching back out to you, and hopefully we can have you back on again in the future and see if we've made a difference. And I'd love to be able to hopefully, identify some drivers. I know it's confidential, but we'd like to hopefully hear from some drivers out there that took advantage of your program, and maybe we can have someone come on and talk about their success. So I thank you very much again, Giles. So I'll be in touch.
Yeah, we would really love to hear from drivers who use the program. We would really love to do this.
Very good. Well, we'll do our best to get it out there for you, Giles. Thank you again, my friend. Have a good weekend.
Likewise. Thank you.
Bye-bye. Only PrePass provides waste station, bypass, and integrated electronic toll payment services. Visit prepass.com for details.